Good morning, everyone. My name is Annie, and I'm the Public Services Director at Kent County Public Library. We are very excited today to be partnering with AARP of Maryland in order to bring you Tell Me What the Doctor Says, the art of partnering with your healthcare providers. Today's presenter, Betty Ciesla, is a volunteer with AARP Speakers Bureau. She has 38 years of experience as a medical educator, which makes her an excellent presenter for today's topic. Today's talk is the first in a three-part series that we are partnering to bring you. The next program will be April 8th, and the focus will be gadgets and things to help with aging in place. And then on May 13th, we will be talking about living life with losses, after losses. So without further ado, I'm going to turn the floor over to Betty.
Good morning, everyone, and I'm delighted that you're all here. This is important information, I believe, in creating a better environment for everyone concerned in their office visits, medical visits, and we're going to be sharing a lot of useful information this morning. I believe that the older patient population is a little different these days for the facts that they are very socially active, they are contributors, they use resources, and they want to be more involved in their healthcare. So let's travel with me through this presentation. Okay. All right, our second slide is what questions would help you understand better what the doctor said? I'm sure some of you have had the experience, as I have had, of having some meetings with my physicians that have not been the best from the communication standard. So here's some things that we can think about that can make each one of us an advocate for yourself and potentially for other members of your family, and also some ways in which you can reduce confusion and anxiety after your doctor's appointment is over. So we're going to be providing some information that I believe everyone can know and absorb to make these things happen. Having trouble. Sorry, I'm having trouble with moving these slides.
That is no problem. We understand that technology is complicated.
Betty,
Yes,
do you have your mouse on the slide?
Yes, I do.
Okay, and then you're using the down arrow.
Actually, I'm just using the forward arrow. Okay, there we go.
Okay.
Okay, hopefully that'll be better. Okay.
Yeah.
All right, so I'm sorry these are moving a little bit slowly. I'll be better. To me, this slide is extremely important because I feel like the best conversation that we can have with our medical professional is the conversation in which you are a partner rather than a patient. A partner will make you more informed, will make you feel more comfortable, and will make you be an advocate in your healthcare. And I believe that these are all things that are so necessary in the coming years and now. So here are the things that we need to be thinking about: being informed versus just following orders, making decisions, helping to be part of the one to formulate a care plan that is geared to your needs, understanding what it is that the doctor is saying, and being able to advocate for yourself. Also, too, if you didn't know, most patient visits are 20 minutes. So that is another element that we have to sincerely think about. A lot happens for each one of us in a doctor's appointment for 20 minutes, and we can benefit most if we're involved in that 20-minute conversation. And here are the things that I feel are the most necessary. How can you become a more active partner? First of all, you can feel comfortable enough to ask questions. I hope everyone can eventually feel comfortable enough to seek explanations for terms you don't understand or conditions you don't understand. And then all of those are factors in managing your healthcare. And I'm hoping that everyone is beginning to feel the need and the capability of being a much more active partner in their healthcare. So this involves some skills, and these are some of the skills that I'm hoping that I can introduce to you. First of all, the skill of being organized before your appointment. Making a list of questions, making a list of concerns, putting at the top of the list the things that matter the most to you or the things that are most important. Knowing what is your current list of medicines and supplements that you have. Knowing if you need prescription refills, and having pharmacy contact information and insurance company information. All of these are important in making the best of your 20-minute doctor's appointment. Once again, we're talking about preparation. If you've never thought of these things as preparing for your office visit or ER visit, let's put it in context and let's make it something that every one of us can do, okay? We can talk about how we feel and using the terminology and the terminology that you also have. We can talk about objective information, which we will talk about. My blood pressure, data from a fitness app, or something that you are using that may be important for you and your healthcare. We can also think about what's going on when symptoms occur. Is it in the morning? Is it at mealtime? Is it when I'm stressed? All of these are important factors, even if you did not think that they were important factors. All of these are important factors, to make you a partner in your healthcare. And also, too, not only letting your doctor know about this information, but discussing it for him in the best way possible. So we're going to be learning some information here that I know is extremely useful, and we're going to be learning about medical abbreviations. We're going to be learning about normal ranges. We're going to be learning about a few parts of medical terminology. Not that I expect everyone to absorb this all at once. However, okay, each one of these things are very important and can be very useful, as you become a partner in your healthcare. So we're going to start out with testing. Everybody that is over 50 has had one of these tests. And not many individuals know what this means and what is involved. So we're going to do it as simply as possible. CBC, complete blood count. BMP, basal metabolic profile. And CNS is for culture and sensitivity. You probably have heard of these. You may have seen them written on doctor's orders, but it's important for you to have some idea of not only what these terms mean, but what is being tested for in these terms. All right, so let's familiarize ourselves with some basic terms, and you will find these very helpful. Complete blood count. The basis of a complete blood count is, what is my white cell count and what do white cells do? And we know that. What is my red cell count and what do red cells do? And we know that. And what is my hematocrit? And what does hematocrit do? So those are the essentials of a complete blood count. The next test is basic metabolic profile. Now, when you're talking about basic metabolic profile, then you're talking about chemistry terminology. And chemistry terminology is something that all of us are familiar with, because what does chemistry refer to? Basic chemistry refers to what is my blood sugar, what is my sodium, what is my potassium, what is my chloride. Anyone who is on blood pressure medication or anyone who is on the diabetic profile will be getting a basic metabolic profile. The next terms that are interesting in basic metabolic profile are BUN, which stands for blood, urea, nitrogen. Okay, this is the beginning of a series of kidney function tests. So when you see that as an order, okay, usually that is testing for kidney function, and usually in a basic metabolic profile, you will see 5 or 6 things, including blood sugar, sodium, potassium, chloride, and kidney function test. The last thing I'd like to talk about is, and I'm sure some of us have had this done too, is culture and sensitivity. A culture and sensitivity is information that will enable the laboratory and your doctor to know whether there is a bacteria or fungus present, and that usually involves a swab. And I know almost all of us have had a mouth swab or some kind of swab at some point in time or another. So these are basic terms concerned with testing that almost every one of us have had at some point in time. Now, the other thing that physicians and your physician partner and you are interested in talking about is normal range. Very few individuals pay attention to normal range, and normal range is extremely valuable, because normal range tells you what is normal on any laboratory testing for a specific age group and sometimes for a specific gender. So I'm just going to give you a very simple idea of a normal range so you'll get the feel for it. A white cell count normal range is between 5,000 and 10,500. It may be slightly different according to the hospital you're at. It may be slightly different for males or females. However, if you hear the phrase that says your count is outside the normal range, then that means that it's either too low or too high, and that usually means something. So usually you can follow that up with a question, and the question should be, what does that mean? And what are you thinking of as you're looking at my laboratory parameter that's outside of the normal range? That would be the simplest thing to do. Now, let's talk about not only being a partner in healthcare, let's talk about you considering yourself an advocate, which is what I want every one of you to consider yourself an advocate, a partner and an advocate. This is your health care, okay? Most of us are, when we make big decisions, we pride ourselves in being informed with about making big decisions because we've done our research and we've done some thinking, et cetera, et cetera. To me, healthcare is no different. Healthcare is extremely important. And the better informed we are, the better we can advocate for ourselves. And why should we consider ourselves an advocate? The reason why is because our doctor is providing a service. He is. Our doctor is providing a service. And as a part of the healthcare team, which is what you are, okay, you are an advocate for yourselves. The best way to be an advocate for yourselves is to ask questions and stay informed, and to feel like You have the quote unquote, I don't want to say, you have the need to ask questions just so the conversation between your physician and yourself can be easier. Remember, healthcare is a partnership, okay? And you should be able to anticipate that your doctor will be able to answer your questions. And you should be able to anticipate that your doctor knows a little bit about you and how you roll through these things. And you should be able to anticipate that your doctor could consider your preferences about different things, especially medical situations. I had an occasion just recently to be aligning with a new doctor for myself, someone that I had chosen. And he started our conversation by saying, "Tell me a little about yourself." We didn't discuss anything about why I was there yet. He offered, "Tell me a little about yourself." Right away, that's the beginning of the partnership. It's the beginning of the partnership. Everything else flowed. Okay, so these are the words I'm going to be using, and these are the words I hope that you can take upon yourself. We're not only talking about partnership and advocating, we're also talking about patient engagement, which I just elaborated upon. Patient engagement means information transfers between patient, your doctor, and your healthcare team. I'm hopeful, I am hopeful that that individuals speak with their physicians, okay? They feel comfortable enough to speak with their physicians, and they transfer information so that when they walk out of an ER or an urgent care or a doctor's office, they have information, they have the next steps they need to proceed, because that is what partnership is all about. This an engaged healthcare consumer, which we all can become, okay, can eventually access their medical history, know their diagnosis, and participate in continued care. Imagine what that would be like for most of us. Imagine. I have electronic health records here. Everyone knows that you have access to your electronic health records. Very few people go that route, but you absolutely do have access to your electronic health records. Okay, so we're going to be talking again about patient engagement, okay? The key word is preparation and willingness to ask questions, okay? And letting your doctor know what your concerns are, okay? What I don't want to happen is I hope that no one will leave the doctor's office in a state of anxiety because they didn't ask the questions, not because they didn't hear what they didn't want to hear, but because they didn't ask the questions. They wanted to share some more information. They were a little bit hesitant, but I believe if we think about all of these preparations that I have shared with you today, I can make you a stronger partner in your healthcare. If you don't understand what the doctor is saying, ask for the information, okay? If you have concerns for your doctor and he keeps on moving through, let the doctor know about your concern, even if it means information, even if it means something like this. Can you wait a minute and I have some questions I need to ask you. Can you wait a minute? I have some questions I need to ask you. Or I didn't understand what you said. Can you give me an exclamation for that so I can understand it better? There's nothing wrong with that. Partners do that, okay? Patient partners do that. And also too, ask the doctor about what his care plan is. Some physicians give summaries at the end of their meeting. Some physicians don't. If they don't give you a paper summary at the end of the meeting, then you need to have the care plan. Then the doctor needs to tell you what the care plan is so that you can hear it And also too, so you can take notes so that if you have any question, then you can call and you can ask. That is engagement. That is engagement. There is nothing wrong with talking to our doctor. There is nothing wrong with talking to our doctor. That is what partnership is all about. Now, most of us will be in a variety of settings. I've concentrated the last couple slides on patient visits, but there are other settings that all of us as potential partners may be in, and that is the ER settings, clinic settings, hospital settings. And in those settings, things are a little ramped up. Things move very quickly in those settings, okay? So in settings like the emergency room, treatment, diagnosis, and the follow-up care is very fast moving. So what I'm going to present with you today is just a few abbreviations that you might hear in that setting that may help you along your pathway to getting the best care and getting out as quickly as you can. Okay, these are a few of, excuse me, the abbreviations that you might hear in one of those settings. These are really interesting abbreviations. You have probably seen that on some of your medical records. You may have seen it on a pharmacy slip, but these are some of the ones that I chose, not too many. UTI, you'll hear these flipping around from mouth to mouth. Urinary tract infections. TIA, transient ischemic attacks. FBSs, fasting blood sugars. FUOs, fever of unknown origin. CVA, cerebral vascular accidents. H&H, hemoglobin and hematocrit. Sorry. These are medical abbreviations that are important, that you might hear, that might help in your care or becoming a partner in those situations too. So just becoming familiar with them, is going to be not a necessary, but it would be important and it would be extremely helpful. These things are going to be flying around emergency rooms and clinics. One of the reasons why I talked about abbreviations as well as the other terminology is because many of us will have more than one doctor. So, and we will, you know, I myself have 3. So for that reason, okay, it's important for you to consider yourself as a partner to each one of the doctors that you are familiar with and that are your team, your doctor team. Each one of these doctors are going to be a little bit different, okay? Certainly they're going to be a little bit different in their response to you, in how they handle things. However, that does not mean that all of the partnership advocate things that we have talked about can't be used effectively for every one of your physicians, because they are all what? They are all a part of your healthcare team. And what do we want? We want the best from our healthcare team. We want to know what is happening. We want to know why it is happening. We want to know how can we make it better. And we want to have conversations with our healthcare team. And if your doctor is reluctant, then you need to do a good job of asking, say, this is the information that would really help me. And we are partners in this health team. In effective partnerships, every provider must share information. That's what makes an effective partnership. You share with him your needs. He shares with you how he can best help your medical needs. If you have an open line of communication among all players on the team, on the healthcare team, then we'll have the best communication and medical care possible. Okay, so once again, okay, and I know it may seem like we're repeating these, but I'm trying to say it in a little bit different way so that it will come into you and be part of what you're working on for the next time. Sharing decisions and care plans. I think it's very important for each one of us to review our test results and see what they mean, especially now that you know what normal ranges mean. It's going to be important to clarify and ask questions if you don't understand what your physician has said or your clinic director has said. And then you have to see yourself as not only a member, a partner of the team, but also an important member of the team, It is your healthcare. It's got to be the best possible. You have to know it. I believe you have to the best of your ability, understand it, and then work along with your physician for the best care plan. So this is a repeat, but we're just going to move down to here. If you're in a partnership with your healthcare professional, then everyone provides a productive conversation. You may not have ever heard this with respect to an office visit, but I believe that is essential, okay? One of the things that I've been able to help some individuals in family and extended family is with their partnerships, okay? I have shared the essentials of what a good partnership should be, and it has really helped. It has helped and it has made it much more productive. Okay, so we've gone through most of this, so I'm going to skip through this one. And we're at the end of the presentation. I appreciate your listening. I appreciate your absorbing it. I hope that many of you are going to be inspired to little by little become a more informed partner on your healthcare team. I think especially now, it's going to be much more helpful if we all become better partners in our healthcare. So thank you so much for listening in, and I hope you'll be able to, the next time anyone asks, tell me what the doctor said. And that will be you. You'll be able to tell me what the doctor said from beginning to end. And wouldn't that be fabulous?
Thank you so much, Betty. We do have a question that came in through chat.
Sure.
Someone has said that they don't have a computer, so don't have a way to access an electronic health record, and asks for suggestions for the best way to get and then keep track of a medical history without having that electronic record.
Yeah, that's an important question. I may suggest to them that their physician or the physician's staff may be able to provide them, if they don't have a computer, with the electronic records. Okay,
So
that
meaning
may
that
be a
they
way to get started with the electronic records. Just copies of their electronic records. Everyone can ask for that and should be provided to them. If they would like a complete copy of their most recent electronic records, that can be provided.
I hope that answers the question. If there is follow-up, please feel free. And you are welcome to, as I said before, use the chat to ask questions, but you can also unmute yourselves if that is easier, or if you would like to engage that way. And the floor is open if anyone does have burning questions. This has been a great, such a great overview, and I know your focus is on older adults, but gosh, I wish this were taught in high school. It's crucial life information that you've just shared.
Well, actually, I wrote a paper on this topic in 1988. It's just I never was able to present it physically like this because I was teaching at 3 different universities. So I was never able to present it, but it's not, it is as useful then as it is now. It really is. And I kept that article, and it was from heaven that I kept it. So I was able to use it.
That is fantastic. There is another comment in the chat. Catherine says, very interesting and helpful presentation. I'm just curious, I've never heard of a health educator before. What background does one need to become a health educator? What kind of activities does a health educator do, and in what settings?
Okay, I gave myself a general title. In actuality, my profession is laboratory medicine, clinical laboratory medicine. And I worked in the clinical laboratory for almost 8 years. And then I started educating. And as I taught, the subjects that I've taught at the universities that I have taught in are hematology, coagulation, blood bank, medical terminology, and scientific writing, all of those. And they have allowed me to progress into all of these areas.
That's so neat. One more showcase of the importance of education in a variety of ways, formal and
Absolutely.
informal, and taking it on the road.
Right. I mean, my medical terminology, I taught medical terminology for 10 years. It was so incredibly useful and continues to be so incredibly useful because, I understand what they're saying. I understand.
As someone who also works in a profession that is very jargon heavy,
Yes.
that
Yes.
having people who are able to communicate around the vocabulary is so crucial for providing good service to everyone.
I couldn't say it better, Annie. I could not say it better. Thank you. That was absolutely perfect.
Oh, well, thank you.
Yeah.
Well, if there are other questions, we would love to hear them. If not, we can move towards saying thank you and goodbye for this morning. I'm going to go ahead and, oops, nope, I'm not. Yes, I'm going to go ahead and unshare your screen so that we
Okay.
can. Oh, nope. Actually, if you can click that.
Oh, I do.
That
Stop sharing.
button. I'm sorry.
That's me. Okay.
There we go. All right. So if there is anyone else who has a question, now is the moment to ask it. And if not, I will say a huge thank you to Betty and to Phyllis for helping coordinate this. The AARP Speakers Bureau of Maryland is a fantastic resource. Like I said, we have 2 additional programs with them scheduled later in the spring. And I will go ahead and put in the chat a link to our calendar. So if anyone would like to sign up to join us for those additional programs, they are upcoming and we would love to have you back.
Thank you so much. Thank you. Take
Thank
care
you
now.
so much for being here.
Okay,
Bye-bye.
thank partner.